back. This is Boomer Life on CIL 650.
And welcome back to the show. This is Boomer Life on CL 650, and we're talking with the Snore Dentist, Dr. Sharnell Muir, based in North Vancouver, right?
Yes.
So you are near an iconic landmark. Anybody that lives on the North Shore knows it's Oasis Car Wash, right?
Yes, yeah,
so
kitty corner from that.
So kitty corner from that. Now, you do have people that come from around the Lower Mainland because you're one of two Snore Dentists, is that right?
Yeah, there was originally 5 of us, and 2 have retired or partially retired. One retired for sure, one's partially retired. One turned 82, I think, last month, so he's close to retirement. And then there's 2 of us left. So there's not a lot of us in the province. We all practice in the Lower Mainland area. And also, I also go to the island, but we're all located down here. So many patients come to North Shore.
You don't have to go to the North Shore, though. You have other clinics and things you visit, is that right?
Yeah, I try to make myself available if I can. It depends on demand and busyness in my own office, for sure. But I definitely do. I do try to see patients down in the West Broadway corridor once a month.
Where all those medical buildings are, right?
Yeah. And then I go to Vancouver Island once a month as well.
And you can do an appointment online, right? For your North Shore location. And so it's snoredentist.ca. You just go in there and fill it out, right?
Yeah. So there's an online appointment schedule. We're actually just redoing the scheduler. We've had some feedback from patients about what they'd like to see and how they'd like it to operate or kind of become more user-friendly for some people. So we're just in the process of changing that. But the one that's there works perfectly fine. You can schedule an appointment right in North Vancouver. But if you want to be seen in another location or want to find out if I will be anywhere else, you can always just call the office and leave a message. If I'm not able to answer the phone, the answering service will.
Okay. Now, we're talking about the kit that you take home, and it was brought to my attention that, say, a province like Ontario, much bigger population, but they have more kind of sleep labs. Is that what you're saying?
Right.
Yeah. So tell us the difference and why this home kit is so good.
Right. So there's 2 different types of sleep studies commonly used. One is called a level 1 sleep study, where you would go to a hospital or a facility where you sleep overnight.
So UBC
is one of them.
We've had them on before.
Yeah, so UBC has one, the Abbotsford Hospital has one, Richmond Hospital has one, Victoria, Nanaimo. So we have, I believe, and I may be incorrect on this, but I do believe we have 10 or 12 facilities that do the level 1 sleep studies, and each facility will have anywhere from 2 to 4 or maybe 6 beds at them. So they're relatively small clinics, and they are great for doing very in-depth studies for patients because they hook up and they do brain waves, they do leg movements, they do all sorts of things for patients that really maybe are more complex or have done a home sleep monitor and it just wasn't conclusive. So they need a more in-depth study.
But this is a good first test to see if there is an issue or maybe it's just snoring.
And it is adequate for the vast majority of patients.
So one thing we didn't talk about in the kit is, so you talk about the belt that goes around your chest that measures breathing in and out, and it's also the data collection units there. Then you have the airflow through your nose that's collected, how much air you're getting, and then how much oxygen is in your blood with a little finger, not a probe, I guess just a...
Just a little rubber cup that sits on your finger.
But there's also, I found interesting, a measuring tape that comes included. What are you measuring?
Well, it's important to measure your neck size. And there's a correlation between neck size and the risk of sleep apnea if it's combined with a number of other things. So we always keep track of patients' neck size. We also try to keep track of patients' weight over time as well. But the neck size, often, if I ask men for neck size, they'll give me a shirt size if they still buy shirts by sizes rather than small, medium, large. But
those of us who don't wear a tie, I still couldn't tell you.
Yeah. So, a lot of guys will know their neck size as their shirt size is 16 and a half inches or whatever. So we're looking for neck sizes in men, certainly 18 inches and over, that would be a red flag for someone that may be carrying a lot of weight around their airway and are more apt to collapse.
So the fat that's around your neck is not just on the outside, it's growing on the inside. Too. So it's putting pressure or maybe making the airway narrower?
Right. So by its mere presence, it can actually constrict the airway. But as it rests and you fall asleep and the airway relaxes, it's more apt to collapse with that weight around it. So you can collect fat on the inside of your airway neck area as well as base of tongue. And a lot of people don't understand we actually store fat in our tongue. So that can be problematic for some airways as well.
So would Gene Simmons have a fatty tongue? Or?
He just has a really long one.
I used it to great success being famous around the world. We're speaking of Gene Simmons from Kiss, of course. Yes. And that's a segue for Dwayne to get us a Kiss song.
There you go.
Rock and roll all night, and party every day. That should be your new slogan. Rock and roll all night and party every day. So Dr. Sharnell Muir is my guest, the Snore Dentist based in North Vancouver, but you do move around and visit clients throughout the Lower Mainland. We're talking about snoring and sleep apnea. Now, when you get this home kit and the data is in the little box that is around your chest, do you look at it or does somebody else look at it?
So I actually have my patient sleep studies all scored by what's called a PSG respiratory therapist. So it's a respiratory therapist that has special training in scoring sleep studies. So the sleep data is sent to that person and they score it manually. There is an auto-scoring software in the machine. That'll tell me basically I have enough data. It's relevant enough to use. It gives me a good idea. I briefly look at that. If the study is good, it goes on for what's called scoring. And then all of my sleep studies are then interpreted by one of our very few sleep physicians in British Columbia. And I have a relationship with a couple of sleep physicians, and they interpret all of the sleep studies for me so that I can make sure the patient has been diagnosed correctly. That information is then shared with the patient's family physician.
That's good because I think a lot of people might say, well, you're just trying to get me into an appliance to help me to sleeping, but it's fact-based.
Yes.
And
that's important. It's important that the patient be properly diagnosed. This isn't just slapping a piece of plastic into someone's mouth so they don't snore. This is looking at it and making sure that they do or don't have a condition that warrants more medical concern. And it's also important because then I can go on, I can repeat the home sleep study with the appliance in
later.
And I can objectively verify that the therapy is effective for them.
So when you get the sleep appliance fitted and you try it out, how far down the road should you get the test done again?
Depending on the patient, usually between 1 and 3 months of wear. We'll repeat the home sleep monitor, and sometimes we'll fine-tune the appliance adjustment and then repeat the home sleep monitor again.
So that sounds interesting. Apparently that has my name on it.
Yes. Yes, it does. Yeah.
You're dying for me to take this home and try it out. I'm traveling in the next little while. I'm not trying to pawn it off because I do want to do it. But it's interesting because, I have a situation where you're getting older. I've been told I snore. Blood pressure is a little higher than it should be. Not high blood pressure, but my doctor says, you got to watch that. So these are all telltale signs, right?
That's right. And there's a couple of other characteristics that patients can have that when you look at a patient, you're like, that might be a red flag.
What are you looking at?
For instance, if you draw a line from the bottom of your chin to your Adam's apple, and if you draw that line there, there should be a centimeter of space between that line and the tissue that hangs underneath.
That's my ancestors' fault.
I know. And that's why there's a genetic component to this.
Yes, because my family's all Scottish, and both on my mother and my father's side, they're all jowly, right?
Yeah.
And I'm fighting it as much as I can, but that's
jowly inheritance.
So that fat underneath your chin is also in the back of your throat, right?
Right.
I see. Okay.
So that combined with maybe some crowding in your teeth, indicating that the jaws might be a little small for space. And or also when you close your teeth together, if your top teeth bite over your bottom teeth more than 50%, that's called a deep bite. And that also indicates to us that the lower jaw might be too far back or up, squeezing the space.
Just give me the story. Just tell me now. So I have all of that, right?
You have all of that? And you also have inclined upper teeth.
Yes.
Right?
That's also my Scottish.
Yeah. Right. So it's
all stacking up against me.
Yeah.
So I got to get this tested.
You got to blame your ancestors, though. You got to blame someone, but you got to look after it yourself.
And that's something about snoring is that it's people laugh it off, and I snore. Whatever.
You know, there was a study done at the Henry Ford
wait a second. I just want to
Center.
stop for 1 second. When you saw me for the first time, you said right away, didn't you? He snores. Well, how come it's taken all these months?
I bring one. Every time we do a show, I bring it, but you're always traveling to some exotic, wonderful place.
Detroit.
Yes, you're a busy man.
No, I will do it.
that.
I promise you I will do it.
Yeah.
But can I do it on the airplane? No.
No.
Wouldn't be a good place.
Because if the person next to you was snoring, I wonder if we would pick up some of that.
Anyway, you were mentioning a study.
Yeah. So, no, I want to talk about the snoring thing because, you know, we as yet think snoring is cosmetic. It's a social condition. It really is. It's laughed off. It's joked about. It's, you know, you get the elbow therapy. But, you know, there was a study done at the Henry Ford Center in the U.S.,
Henry Ford, Detroit.
I believe they're in Detroit, yes. And they found that there was a correlation between snoring and things like atherosclerosis in the carotid artery. Well, that's that plaques that builds up in the throat artery. And that's the artery that goes to the brain. So they're trying to figure out whether it's actually the irritation of the vibration of snoring that causes that to develop in the carotid artery. And is it more than just maybe an irritating social condition? Is it maybe that it may lead down the path to other cardiovascular issues?
Now you're scaring me.
We don't know it yet. We're learning a lot more. Snoring's still considered the laughable social condition.
That's true.
Yeah.
Well, we've talked about snoring. We've talked a bit about sleep apnea. We're going to get into that. We also talked about the take-home kit, but we're going to get into the devices next and how they work. We're speaking with Dr. Sharnell Muir, the Snore Dentist, next on CL 650.
Celebrating the baby boomer lifestyle. This is Boomer Life on CL 650.